Hey, IC healers. I want to do this presentation on mycotoxins and fungus and your immune system, also histamine, because I think it's important that you understand the connection to it and your symptoms. Of course, when I first started doing this, I thought it was going to be like 10 slides, and before I knew it, it was almost 100. So this is probably going to be about 30 minutes. I'm going to try to rush through this and not go over all the details. It's just one of those things, as a scientist, and my eye always starts with something small and it turns out to be a big project because I opens a can of worms and I start to just see things and I'm like, oh my God, this is just amazing. Like I found a link, another link. And so this is why things take me so long to get them out because they just get out of hand. But anyway, now, there are other things going on as well, of course, such as post-infectious nerve dysfunction, but you're going to see how that's linked to mycotoxins and fungus. And as you know, I've just done some extensive advanced training on the organic acid test. And so I've identified the role that these things have on your immune system and the oxalate connection and histamine connection, which is why every single person with IC, every single one of them needs to run at the very least an organic acid test. And then on top of it, I would recommend a mycotoxin test, at least just to rule it out. So, hey, do I need to open that can of worms? Do I need to check my house? Is there something going on that I'm not aware of? And then I would even consider a glyphosate test just to see, what your exposure is to glyphosate, because that's another issue that I'm not going to talk about today, but it's really important. And then you can even run a tox profile to see, other toxins in your body. And so that'll give you some focus on detoxification strategies. I don't recommend doing the tox all the time. That's just like a one-time thing. I think once you start detoxing, you should, if you want to test to see if the levels are going down or not, that's good. But I think organic acid should be done at least once a year. And I think when you first get started, you should at least do it once and then again 6 months later. But that's just, the way I would do things. So anyway, let's keep going. So I want to thank Great Plains Lab for their wonderful training. And also FDN also had a great training on 20-hour lectures, 20 hours of lecture on the organic acid testing, which was really amazing and really taught me a lot in how I can clinically apply this test to IC. So again, the states of health and disease are the expressions of the success or failure experienced by the organism in its efforts to respond adaptively to environmental challenges. This is now my quote for my practice. It's going to be my mantra, because our health is a result of our inability to adapt to our environmental challenges, and that includes things like glyphosate and toxins and EMFs and mold and candida and diet and stress and all these things. It's just a perfect storm, and that's the basis of my 8 causes of IC. And of course, please keep in mind this is only for informational purposes, and I'm not using this as a diagnosis or treatment for medical advice. Seek the advice of your physician for any medical condition. Okay, so before we begin, it's important to ask yourself a few simple questions. Some of these are to ensure that there are not other things at play, such as Lyme, Epstein-Barr, heavy metal toxicity, or toxoplasma. So some of these questions you see on this slide, you should always ask yourself first, just to kind of rule out other things before you start chasing, what I'm about to talk about. And here's why. Well, first of all, have you ever had lived in a house or worked somewhere with unknown mold exposure and water leaks? This is important even if you're no longer living in the environment, because the toxins can become colonized, the mycotoxins can become colonized in the fungus in your body, in your gut, and so it's important even if you don't live in that situation now, that you identify if you ever have been exposed to that. And then, of course, there's things like tick bites, or if you've ever had mono, deep amalgam, or have you had amalgam fillings, and if you've ever had a cat, or if you currently have a cat. So before we get into the mold and the candida, I want you to understand that there is symptoms of encephalopathy, which is most often seen in Lyme and co-infections. So if you have any of these symptoms you see here, although they can actually mimic some symptoms of mold, a lot of these can also be related to Lyme and its associated co-infections. So if you do suspect that, it's really important that you get to the bottom of it and go see a Lyme literate medical doctor. But I will also say that chasing it is not the answer, because almost everyone's been exposed to Lyme. Here's some more symptoms, by the way. Okay. Twitching in the body is the big one. That's the big kicker. It usually tells me there might be something else going on. So most of the tests are inconclusive, and so many people don't even see the target lesion, and that's because it's found in saliva and vaginal fluid as well. So you can actually catch it. It's not an STD, but you can transmit it sexually, and then kissing too, and it's in every state. So more than likely, all of us have been exposed to it, and so it really does boil down to your immune system. And so I talk about this in my coronavirus lectures, but I'll recap. We have two arms of the immune system: the innate immune system, which is what you're born with. It's your first line of defense, and it's first responder. Okay, it secretes chemicals to kill the pathogens, and these are often seen in blood work with your monocytes, neutrophils, and basophils and eosinophils. Okay, so this is a part one of your immune system. And then the other part is your adaptive immune system, which is your second line of defense. And that includes, antigen specific, although I will say your first line of defense also includes your skin, right? And secretory IgA, your gut, things like that. Okay, so, but then your second line is your against pathogens, and that's antigen specific, and that develops over time with age. So what happens as we get older, our innate immune system declines with age and our adaptive immune system ramps up. And that's one of the problems we're seeing with the coronavirus, because it's an overactive adaptive immune response. And a lot of times people are Th2 dominant, and that's more of an allergic profile with histamine and all those other things. By the way, mold can promote that as well. So we're dealing with, I believe, people with coronavirus complications and upper respiratory problems are actually probably have mold exposure, and they probably have fungus in their body. I've already found several studies that validate this theory. I haven't actually come out and said it yet because I've got so much going on. Coronavirus is not really my top priority right now. There's too many people on it, but I do believe that there is a link to mold and EMFs, because EMFs can actually cause mold to grow as well. We were seeing that in some of the studies that some students have done in some colleges, where they've done studies with mold on bread, and they expose it to Wi-Fi, and there was actually a significant growth of the mold on the bread. And I can try to find that study that these kids did. But anyway, so adaptive immune response is your second arm of your immune system that actually is dependent as you get older. The more things we're exposed to, the more T cells, B cells. And another thing to keep in mind is a lot of these T cell responses are in our memory. There's memory T cells. So that's why when somebody says to me, oh, can I cure my autoimmune condition? The answer to that is actually no, you can't. You can't cure it, because the cells are stored in your memory T cells. And that's really important to know, because I think sometimes people have the false impression that they're going to get cured. And there's really no cure, honestly. It's just, you just got to kind of balance out the immune system, and keep in mind that your gut and nutrition are strongly tied to your immune system. So if your gut is not functioning properly, if you're not getting enough nutrients because your gut's not functioning, or maybe your diet's poor, maybe it's high in pesticides, maybe it's got a lot of processed foods, maybe you're not eating enough food, maybe you can't digest it, well, you're going to have nutrient imbalances, and they're all tied to the immune system. 80% of your immune system is in your gut. Okay, so I've talked about that in one of my coronavirus lectures, which is why I can't stand antibiotics, because they destroy the microbiome. Okay, so what are mycotoxins? Well, they are fungus, basically, come from the Greek word fungus. It's a secondary metabolite produced by organisms of the fungus kingdom, and they are capable of causing disease and death in humans and animals. Mycotoxicosis is a disease caused by a natural toxin produced by fungus. They target organs that include the brain, the kidney, endocrine system, which produces a lot of your hormones, immune system as well. And the severity is dependent on how long you've been exposed to it and how much of it, which mycotoxin you're exposed to, what's your age, what genetic predispositions do you have, what's your health status, what's your nutritional status, which everyone seems to neglect these days, and what additional toxic burdens do you have? Do you have glyphosate, heavy metals, xenoestrogens, pesticides? So primary sources of mold include water-damaged buildings and food. The most physiological effects of mold include allergic and inflammatory responses, and also toxic responses. So the primary sources are very prevalent and toxic, and basically they can infect buildings, vehicles, and your food. They actually can be inside, underneath your walls. They can be coming out of your vents. You could be inhaling this all day long. Now, I will say that homes these days are built with very poor and cheap material, and they're basically breeding grounds for mold to grow. So if you live in a humid environment like Florida and your house is older than 10 years, you probably have mold. I mean, undoubtedly you have mold. I mean, there's no way around it. I'm just going to be honest with you. You probably have a mold problem. And most exposures are through food or airborne exposure. And in Europe, 20% of all grains harvested have been found to be contaminated with mycotoxins. And unfortunately, they're resistant to heat and many processing procedures, so you can't just cook them out. Now, not all molds include mycotoxins, but the ones here do. So this one here, Fusarium, is type 2, Penicillium, Aspergillus, which is found in home and food. This Chaetonium is found in water-damaged buildings, Claviceps, water-damaged buildings. So as you can see, a lot of this black mold here, water-damaged buildings, you can see a lot of it's from our home. Common reactions to mold, but not all of them, because you can end up having some silent symptoms as well. It goes chills, nasal stuffiness, cough, eye irritation, wheezing, skin irritation, skin reactions, which also can affect animals, and also cats can have issues with their thyroid gland. All right, other reactions can include headache, confusion, depression, fatigue, irritability, and sleep disorders are actually very common because the mold can exacerbate some other pathways of neurotransmitter production, and that's going to affect your sleep patterns as well. So a mold can suppress your immune system. It can fragment the DNA of lymphocytes and reduce white blood cell activity and macrophages and natural killer cell activity. It can lead to immune suppression. It can lower your secretory IgA, and it can generate free radicals, which therefore depletes your glutathione. And worst of all, it can target your mitochondria. So here are some of the symptoms of mold exposure again. So you may have some allergies, which you can do a lab to identify that. Immune system toxicity that are not allergy, but they're due to mycotoxins. Neurological, endocrine, which is hormones like thyroid and estrogen and things. Fertility, cardiovascular symptoms, psychiatric symptoms, severe gastrointestinal distress, and also some people have bleeding. Other mental health symptoms include dementia, memory loss, anxiety, depression, cognitive impairments, insomnia, and depersonalization and derealization. Yeah, that's another thing I thought was really interesting is when I learned that people who have, they're not with it with time elapsing. So they may have like false perception of the amount of time that's elapsed. So let's say you're working on something and you thought you were working on it for 1 hour and it's actually been 4 hours. That seems to be really interesting correlation to mold. Something I found interesting. So let's switch over to Candida. It's another type of fungus. This one's a yeast fungus, and it lives in our digestive tract, and it's opportunistic in nature and will proliferate if the ecology of the microbiome is dysfunctional or if our immune system is suppressed. So here's a problem with Candida. Even though it's a commensal in your gut, it can become hyphal, and it can become invasive. Things like your environmental changes, such as changes in pH, your food supply, your temperature, or CO2 actually can cause Candida to switch to this more pathogenic form. And many believe oxalates can cause Candida to switch, and also antifungals like nystatin, which a lot of people are prescribed for a very, very long time, can also cause this switching, according to Susan Owens. Candida can also produce ammonia, which I found an interesting connection as well, because it is known to be very toxic to the bladder. That's something I learned with my work with Ruth Chris. She had taught me that. So here's some other issues with Candida. It can hide from your immune system. It can chew up your secretory IgA through these proteases that are released. So oftentimes we'll see low secretory IgA in a GI map. And I'll tell you what, every single person I worked with IC, except for one, have low secretory IgA, including myself. So Candida could be the main reason for that. So you can also notice neutrophils are also elevated with people, or they can also be downregulated if they've been elevated too long. So it can go either way. So you sometimes look for high neutrophils or low neutrophil count with yeast overgrowth. Saccharomyces is competitive with it, which is sometimes why we put you on Restore Flora or Saccharomyces boulardii. Candida can increase sulfur metabolism. So if you have sulfur intolerance, you can't tolerate things like garlic or wine, it could be related to Candida. And glutathione can activate your neutrophils to destroy the yeast. So if you have glutathione deficiency, let's say because you have mold or something, you can actually impair this process. So here's some of the symptoms of Candida overgrowth. I highlighted some of the ones that are most common with IC, like frequent urination, histamine intolerance, vaginal itching and burning, gas and bloating, abdominal pain, fungal infections, nasal congestion, I hear a lot, headaches, migraines, let's see, skin conditions, food chemical sensitivity, asthma, hay fever, I mean, all this. Now, I'm pretty sure my son has Candida. I gave it to him while I was breastfeeding, and I'm actually going to run an organic acid test on him with a mycotoxin test because I do believe there may be some mold in our house. We live in a house that's 25 years old. We're actually moving in July into a brand new house, and I'm probably going to have to treat the air with some essential oils. We could talk about that at another time, but there are some essential oils you can do to treat your air. So I'm probably going to do that ahead of time before we move in, just to prevent the mold. Okay, so mold overgrowth and mycotoxicosis. So some of the causes include the ones listed here, as including also Candida, so either one. But the symptoms of Candida can also involve mold overgrowth, mycotoxicosis. Sorry, that's what I meant to say. Antibiotic use, birth control use, very, very, very common. I've seen a lot of people with long-term birth control use. Uses of non-steroidal anti-inflammatory like ibuprofen, infections, sugar in the diet, stress, poor lifestyle, heavy metal toxicity. Yeah, especially mercury and Candida seem to be best friends forever. EMF exposure, alcohol consumption, and eating fermented foods. So people sometimes think that they can get away with eating all this like kombucha and like fermented vegetables, but that flares me even to this day. I'll do like fermented vegetables and I'll get like my rectal area will start to burn and itch. So I know that's definitely causing some histamine. We'll talk about that in a minute. Here's something really important to know. Candida can produce a toxin known as acetaldehyde, and that can give you this hangover feeling. I notice that happens when I eat fermented vegetables. I'll get like this, like just exhausted feeling, and that's the acetaldehyde from the Candida. Here's the thing, acetaldehyde inhibits your methylation enzymes, right? And also transsulfuration. So histamine and Candida share this enzyme. So Candida overgrowth can actually worsen histamine intolerance, okay? Because they're stealing some of the enzyme activity and therefore causing histamine intolerance because you're not able to break down your histamine. Look at that. Acetaldehyde can also stimulate dopamine and inhibit serotonin formation. So if anyone has anxiety, OCD, schizophrenia, plus on top of it, you may have COMT, which is a gene that we check with the 3x4 genetics, COMT gene, that can also exacerbate this because you're already predisposed to having impaired methylation. And then on top of it, you have this acetaldehyde that's impairing even more methylation. So you have acetaldehyde impairing the enzyme, and you already have this COMT gene, and I see that a lot too, where it's already impaired methylation, and then just put them together and you just got a disastrous storm for OCD and anxiety. And I hear a lot of people with IC complain of anxiety, so this could be a connection. Now you could do alpha lipoic acid, which a lot of people are taking on the protocols. I like the one that has biotin in it because alpha lipoic acid can detoxify this acetaldehyde through this enzymatic activity, helps metabolize it. But then on top of it, you've got the biotin, which also helps Candida go from hyphal form back to its commensal form. So the combination of those two are great. So that's why I put you on the protocol with that. Vitamin C can too, but I don't recommend that because it can increase oxalates. So 500 milligrams is the max. And then N-acetylcysteine and also thiamine. So here's an image that demonstrates where Candida and acetaldehyde and what happens here, and it actually impairs this MTR enzyme, which then can lead to buildup of homocysteine, which sometimes you might see. Not everybody has the buildup, but it can impair this here, and that's why I always ask for homocysteine on blood work. Not every doctor will do that, so you have to ask and request for homocysteine because it gives me some indications of methylation. Also notice that vitamin B6 is involved in this enzymatic process of homocysteine to cystathione. So if you're low in B6, which the organic acid test can also demonstrate the low in B6, you can be impairing that as well. So Really interesting stuff. So it's not always about taking folate, right? It's not always about taking folate, because you could take all this folate and it can actually build up in your body because it's not going through this process of metabolism biochemistry where now this enzyme has been inhibited. And if you're low in B6, well, this enzyme's been inhibited and you may find that you're building up homocysteine, which is not good. Candida can produce oxalates indirectly. It does this by producing collagenase, which converts collagen into hydroxyproline, which can then be converted to oxalic acid. So you look here, if you eat a lot of gelatin or too much protein that has collagen, it can convert to hydroxyproline, and then it can go down this pathway and become glyoxylate, which can then become oxalate. So that's not good. You want this glyoxylate to become glycine, but if you're low in B6, that process isn't going to happen. If you're eating protein here, and the glycine from the protein can go down this enzymatic process through the AGT enzyme, and if that occurs, glycerate can come down and become oxalates. Okay, so again, too much protein in the diet's not recommended. You have to have a good amount, but not overdoing, as much as I don't like the high protein ketogenic diet. And then here's another one, yeast and fungus here can actually go down in arabinose, which is seen in the organic acid test, and it's usually high with people with IC. It can go down and become oxalate that way. And then, of course, there's oxalates in your diet. So it's not always about your diet. That's my point. Candida is in the fungal species, is actually the most commonly associated with biofilm formation. So they can contribute to increased resistance to antifungal therapy and contribute to the ability of cells within the biofilm to withstand host immune defenses, which would look something like this. Organisms in biofilm communities, they communicate via this process called quorum sensing. And that's theoretically why Enterococcus faecalis biofilms are prevalent with IC, because it's an oxalate degrading bacteria. So in the presence of Candida biofilms, and then you've got all these oxalates, which is the food source for Enterococcus, we're seeing a rise in Enterococcus in urine samples, such as the microgen, as well as in these stool samples. And I mentioned this to a few scientists, and they thought that this was very interesting, but no one's really actually sat down and studied it. I have seen a few studies that did talk about Enterococcus faecalis and oxalates. So there's definitely a link. And I know that Enterococcus, being a commensal, can also be pathogenic when it also becomes powerful in presence of other microbes. So if you don't have good microbes in your gut and you've got this, perfect storm, you're going to have Enterococcus come in and say, oh yeah, now I'm powerful. And it can definitely form inflammation as well and become an infection. So just because it's a good guy, it doesn't necessarily mean it's always good. It's good in small amounts, but not in high amounts, is what I'm saying. So this demonstrates that Candida is at the root cause of many of our issues. It's not as simple as eradicating Candida. You really got to remove their food source, and oftentimes that's oxalates. And also mycotoxins play a role too. Heavy metals are huge, especially mercury, which is why I recommend an HTMA test. Toxic chemicals, a lot of people have Clostridia, parasites, which if you think you have one, symptoms of it, you may have to run a stool test, inflammation, food sensitivities. And so it's, really a perfect storm here. So some keys to chronic Candida intervention include dietary control through eliminating the reactive and toxic foods, improving digestive system and microbiome diversity through diet and taking targeted probiotics, prebiotics, eradicating opportunistic infections, and that includes parasites if you have them, bacteria, and in Clostridia too. That's why I like the organic acid test, because it can identify if you have Clostridia. Identifying and eliminating a gut colonization of mold. That is huge, huge, huge. You're not going to get better if you don't do that. I'm just going to let you know that right now. If mold is found and you do nothing about it, or you don't actively take control, it's not just taking a supplement and getting rid of it. You have to remove the source. You have to find the source. You have to remove it out of your body. You're going to have to detox through the gut. You're going to have to do a lot of things, and you're going to have to test. You have to test to see if the numbers are going down. You can't just assume it's going down. You really need to test after several months of intervention. So that's just really, I just need to say that. And then eliminating and reducing environmental toxin exposures, such as chemicals and heavy metals, and ongoing antifungal interventions through medications and botanical remedies. Okay. So here's some formulas for Candida intervention. Candex, which is a biopharmaceutical disruptor, biocidin, alvarox. Many of you are taking this. Olive leaf alone is very good long term. It's just very safe. Also helps lower cholesterol. I like this Candida defense formula through New Beginnings. And then there's monolaurin. Okay. So some people are recommending diflucan, and you could do that temporarily. I don't prescribe that, but you can talk to your doctor about doing some diflucan for up to 30 days if you have pretty significant mold. You can also rotate it with nystatin, but remember, nystatin can also have other problems, like I said earlier. So, and you should monitor your liver function every 6 to 8 weeks. I love Biocidin. It supports the clearance of multiple classes of pathogens at the same time. It can disrupt and dismantle biofilms, and it can also modulate your immune system. So Biocidin is recommended by everybody, every practitioner group that I network with. They all recommend Biocidin. But you got to be on the therapeutic dose. The therapeutic dose is basically 10 drops 3 times a day, which comes out to 2 caps, 2 to 3. I got to look at the dosing. I think it's 2 to 3 caps 3 times a day. If you're not on that therapeutic dose, you're probably not going to get the benefits. Now, if you have Clostridia, you may have to rotate, and basically there's like a protocol where you do it for 3 days and then you stop and then you reintroduce it or something. I have to look up that protocol. I remember what it is. So for the Clostridia folks, talk to me about that and we'll see if we can get you on that rotation protocol. Biocidin. Berberine complex is good too for yeast. So berberine. I also like the Mega Mycobalance, which is SF's same thing as I think it's called SF722. I think that's what it's called. So it's different than monolaurin or caprylic acid. So there's a lot of different things out there for Candida. The key with this is consistency. Even grapefruit seed extract is really good. So this has grapefruit seed extract in it. But I know some people say they flare after grapefruit seed extract, like Argisept. My theory with that is it's probably releasing the endotoxins because it's very powerful. It's probably releasing the endotoxins of the Candida, and it's just causing more inflammation because those is pro-inflammatory substance. So metabolite. Okay, so back to mold. So common mold toxins include the ones listed here. Black mold is this one. They can make underlying problems worse, and they're very immunosuppressant. So if you have a problem, it won't get better with mycotoxins present. So I'm going to repeat that again. If you have a problem with mycotoxins, it won't get better if they're present. Lyme disease can also be associated because all this stuff impairs your immune system. Mitochondrial dysfunction, allergies, fatigue, all these things. Mold can be really damaging to the body. Okay, so here's a case of high oxalates associated with Aspergillus. So this person here had high Aspergillus on the organic acid test, and look at his oxalic acid. Now, these are also different, gives you clinical signs of type of hyperoxaluria you may have. This one's primarily external or can be also produced from Candida. And mold, these two can give you indications of type 1 and type 2 hyperoxaluria. Believe this one is the genetic version. So if these two are very, very, very high, there could be a genetic thing going on as well. Here's another one. Here's the strains, Aspergillus, and then look at oxalic acid, tartaric acid. Okay, these are other succinic acid. These are also other metabolites on the organic acid test and also on the mycotoxins test, mostly organic acid. Interesting oxalate crystals are found on Aspergillus. So here's a microscope image of Aspergillus cell, and you can see the little oxalate crystals within that. Here's oxalate deposits on fungus on tree. So that tells you all. You probably can't see it as well, but this was the image that was presented to us in the Organic Acid Conference from Great Plains Conference. Here's a case study of localized peripheral calcium oxalate crystal deposition caused by Aspergillus. 70-year-old white male was found malnourished and demented and had painful black gangrenous appearing right foot. And they found that the tissue specimen showed numerous crystals, which were identified as calcium oxalate. And they found out that this was due to Aspergillus. So no other systemic or other metabolic causes of oxalosis was found. Calcium oxalate crystal deposition was felt to be secondary to Aspergillus infection. So that's really eye-opening. Mycotoxins can promote mast cells. This is really important because it has an important role in the innate and adaptive immunity. That's what mast cells can do. And they recognize harmful antigens by binding to these pathogens on the mast cell surface. And once it binds, it can cause inflammatory mediators such as histamine. Histamine can promote tissue inflammation. This is important for you to understand because, as we talked about, you need to have a balance between the innate and adaptive immune system. And there's your mast cell, okay? Right? So if you have mold, it can promote these mast cells to be overproduced. Well, why is that important? Well, it's important because chronic exposure can activate this inflammatory process due to these mast cells, and they can be overactive in some people, and some people with IC also have mast cell activation syndrome. So one of the questionnaires that I asked is about this. So I created a new questionnaire on histamine and mast cells. So please fill that out if you haven't yet. And the chronic inflammation that results from this vicious cycle could explain why some of the symptoms we see often in patients with mast cell activation syndrome equals brain fog. Sound familiar? Fatigue. Some people have skin rashes, hives, which is why I ask you these questions. And when we do the nutrition-focused physical exam, when we do our one-on-one meetings, we did that extensive physical exam together, and I asked a lot of questions about your skin. Do you get hives? Do you have swelling? Do you have brain fog, fatigue? These are all clues, right? Here's some other diseases that are associated with mast cells, and there's interstitial cystitis that I put a big fat arrow next to, but then there's others like asthma, autoimmunity. I see Hashimoto's is rampant among IC, lupus, eczema, POTS, chronic fatigue, fibromyalgia, reflux, IBS, migraines. That's huge. A couple clients are like, I have migraines. It's probably coming from mast cells. And mood disorders, such as depression, anxiety, insomnia, and multiple chemical sensitivities. So what's the definition of mast cell activation syndrome? It's a subset of mast cell disorders where episodes of mast cell activation occur without any detectable evidence of a proliferative mast cell disorder. So it's not mast cell activation disease. That's different, okay? You have to get diagnosed by a doctor for that one, like an immunologist. This is actually just a syndrome, which is more common than MCAD. MCAS is more common than MCAD is what I'm saying. So mold, chemicals, allergens, viruses, heavy metals, and toxins can trigger. Symptoms include all these listed here. It's a lot. Okay, a lot of symptoms. Now, why is that important for your IC? Well, first of all, mast cells release histamine and other chemical mediators to attack toxic organisms. And when you're constantly exposed to these environmental toxins, your body is in constant state of inflammation. You can develop histamine intolerance during this constant state of defense. This doesn't mean you're becoming sensitive to histamine. So let's repeat, this doesn't mean you're becoming sensitive to histamine. Your mast cells are actually overproducing histamine to protect your body. So that's why it doesn't always mean that it's coming from your diet. I mean, the diet can definitely promote it if you're low in DAO, and that's a whole different issue. The enzyme that degranulates histamine. And so like if you eat an avocado and then you get nasally or postnasal drip, then you may be low in DAO. You can take a DAO 30 minutes before your meal, and that usually helps resolve the problem. But ultimately, you have to fix your gut because those are driven by microbes. But this is a whole different issue. This is if you have actual like mold or candida, you're actually producing histamine as well. So that's not a gut issue. So here's an interesting study that overall there's an agreement that mast cells play an intricate role in pain syndromes, and in particularly bladder pain syndrome and IC. They participate early in disease development with nociceptive pain by sensitization of nerve fibers. Okay, and that's really important for you to understand. Mast cells produce products continue to perpetuate both acute and chronic pain, leading to the difficult to treat neuropathic pain. Okay, so Friday I'm going to be talking about this in Facebook Live, which will be also on YouTube. So check out the YouTube page for the interview that I'm going to have on this. But this situation makes mast cells an interesting therapeutic target. Mast cell activation syndrome is seen in bladder pain syndrome, IC, and vulvodynia. Okay. Another study identified the role of inflammation in bladder function in interstitial cystitis, and this one demonstrated a 6 to 10-fold increase in mast cells with classic ulcerative IC compared with a 2-fold increase with non-ulcerative. So whether you have 6 to 10-fold or 2-fold, you still have mast cell involvement. So it doesn't really, sorry, whether you have ulcerative or non-ulcerative, you still have mast cell involvement. So it could either be 6 to 10-fold if you have Hunner's lesions and ulcers, and it can be 2-fold if you don't. So there's still an involvement of mast cells. And there's many other studies. Those are just 2 that I picked. Let's see. Mast cell is also involved in neuroinflammation, and activation and degranulation of mast cells can be a result of genetic predisposition, number 1, environmental toxins, number 2, infection, stress, and HPA axis activation, and dietary factors, and of course, gut imbalances. I will tell you it's a 70-30 split. 70% is environmental, 30% is genetic. So don't just blame your genes, also have to work on your environment here. Okay, they have a bidirectional relationship with glial cells, which are in the brain, and they're responsible for neurotransmitter release and things like that. And the relationship between mast cells and glial cells are thought to play a major role in neuroinflammation. And keep in mind, neuroinflammation can impair your body's ability to deal with pain and deal with neuropathic pain. Okay, so you see the result. Mast cells, histamine, there's your microglia, there's your free radicals, and there's your inflammation. IC is associated with mast cell activation, and many folks also have histamine intolerance. Mast cell activation can occur in the presence of fungus, which is often seen with IC when we run OAT tests and mycotoxin tests. I also see elevated levels of quinolinic acid right here, which is a byproduct of tryptophan metabolism and can occur under the states of inflammation and stress. Quinolinic acid is an NMDA receptor agonist, and it can also be excitotoxic, so and neurotoxic, and it's released by these activated glial cells. I know it's a lot of information. Don't worry about the details. Just understand that the main idea here is it can actually promote neuroinflammation, which is brain inflammation. I see this a lot. So these glial cells are activated in response to mast cells, again, cytokines and pathogens, stress, and also microbiome metabolites from imbalanced gut bacteria. So I found it interesting the role mast cells have in this glial activation: chronic pain, neuropathic pain, and general neuroinflammation. There's also a relationship to nitric oxide, which I don't want to get into too much, but just understand that it can activate that. And that's also due to chronic mold exposure, and it may prime your white blood cells to have, and also altered secretion of cytokines, including a major one that we don't want floating around in our body for very long periods of time, IL-6, okay? So it seems to be that there's a role between Candida, Aspergillus, your immune system, inflammation, and nitric oxide as well. So that's another slide that kind of demonstrates that role. All right. Another one there. More slides on inflammation, chronic mold. IL-6, there it is. You do not like, this is a bad one. It's very damaging to the body. Tissue damage and everything. Okay, Candida, Aspergillus, okay, NADPH, nitric oxide, fungus. Okay, more inflammation, aflatoxin. Okay, more information on the brain, glial cell activation. Okay, so then these slides actually just go over some of the different molds. Okay, so this is patulin. We'll go over that in just a minute. Ochratoxin A, which also affects the gut and leaky gut. There's another one on altered neuroendocrine signaling, altered gut integrity, which is leaky gut. Aflatoxin can cause depression, anorexia, diarrhea. And here's a slide that goes over different mold toxins, how it affects your immune system. Look how high aflatoxin is. Ochratoxin here in this one. Some of the clinical signs. Okay. And then the lungs that it affects, notice the kidneys, immune system, gut, liver, central nervous system. Okay. Can't always see mold behind the walls, my friends. Just because the house looks good on the outside doesn't mean it's good underneath those walls. you suspect it, you really got to get tested. It's really, really important to get tested if you suspect mold. Here's a case history. 53-year-old female, getting sick all the time, 4 respiratory infections in the past year, brain fog, and 3 bacterial infections. A tailbone infection, which is interesting, 3 times, and UTI with Pseudomonas, and IV antibiotics multiple times. Wakes up in pain. What is causing these infections? They went to her house. They looked under the walls. Look what they found. That's the problem with these walls. They're like breeding grounds for mold. Like we have no choice these days, right? It's really important to be on top of this. Okay, here's her report. She had Stachybotrys, which is really bad. You do not want that. Total fungus, high. Aspergillus, and then this other one, Chaetomium. All right, so you can see what happens there. Here's this slide. Is an abstract on mycotoxins and global and health and wealth. Something MDs need to spend more time on, in my opinion. There's mold on food. Peanuts are a terrible, terrible food. There's mold on peanuts. I don't recommend anybody eat peanuts and peanut butter. They're not a nut anyway, they're a legume. Oh, so do you smoke pot? Cannabis products may be susceptible to contamination by natural occurring mycotoxins during cultivation, storage, or processing. As natural byproduct of several mold species, aflatoxin and ochratoxin, which are the ones you just saw in the other slides, present serious health risks to humans and animals, including liver toxicity, immune suppression, and cancer. This is according to the International Agency for Research on Cancer. Aflatoxin and ochratoxin A. So if you're smoking pot, you may want to consider that as something you may want to really consider. I'm not going to tell you what to do, but I'm just showing you the evidence. This slide demonstrates the contaminated samples of mold in our food supply among poultry, cattle, and pork that is showing up because of what they're eating. Their food has mold. Mold goes in their body, and then we eat them. I'm not saying don't eat them. That's not what I'm saying. I just want you to be aware of what's going on. Okay, so here's another one. Wheat and corn contamination in our food supply. Wheat, 83%. Corn, these different ones, 61, 93, and 80. Okay, so that's why they're on the elimination diet, to remove wheat and corn. Now you understand. Okay, this slide is another one. Mycotoxins above threshold levels, 6 out of 10. And look at the United States. So we have a lot of corn. A lot of corn mold in our corn supply. You know, I think about it, my son eats corn. I'm almost wondering if it's very possible. Yeah, even though it's organic, yeah, I got to research that a little bit more too. It's hard when they're picky eaters. Limited on what he eats, 8 years old. All right, here's the different sources of mycotoxins. They're found in in the field, storage, and also ergot. So you can see that we can see where they're found: wheat, oats, maize. So yeah, oats. I don't know if people ask about oats. I don't eat oats. I don't eat oats. I don't eat grains. I just don't. You know, it's just something I forego because I know there's just too many problems with them. This is just half of the things. I haven't even talked about glyphosate yet. I haven't gotten into that yet. So for me personally, I just rather not. I know I'm getting exposed in other areas, so why not control what I can control? And that's what I put in my mouth. And there's so many other foods out there. You don't have to eat grains. Trust me, it's overrated. This one shows that in the United States, it does not have any follow-ups. I hate that. That really bothered me. So they have, the first one shows the number of notifications they had when they were notified from the commission's services about mold. And then this is 89 products originating from mold. I think that's what that means. But what we like about this slide is it demonstrates they had no follow-ups. So nobody's following up, nobody's checking, nobody cares. So let's go over each one. Aflatoxin is one that you can get tested for, and this is a carcinogen, and it's found in peanuts and corn. in the southern eastern states, and any corn from anywhere in the US may be affected. So if you're eating a lot of corn products, like gluten-free products, and a lot of them are corn-based, gluten-free products are replaced by corn, you may want to think twice. Patulin is another one that's found in rotten apples and moldy or damaged apples. And these are often used to make apple juice, which is why we don't recommend apple juice. My son used to drink a lot of apple juice. We do not any longer. I'm not saying don't eat apples. Apples are actually healthy for you. It's rotten apples that you don't want to eat. You can eat healthy apples, organic apples. If they're not rotten, eat them. We're talking about rotten apples here, okay, and apple juice, okay, cannot be destroyed by heat. And that's the problem with the pasteurized apple juice. They still have mold, okay. This is another one, DON, Don, and it's found in wheat, corn, barley, and rye, all right. Ochratoxin A is found in cereal, corn, barley, wheat, and oats, and also in edible animal tissues as well as human blood, sera, and milk. It's carcinogenic, not completely destroyed during the processing and cooking. That's key. So don't think you can just cook it and make it go away. It doesn't. These are toxins. Toxins usually don't get destroyed by heat. The microbes do, but their toxins are left behind. That's a whole other topic to talk about about FSM when we have the FSM conversation, which is, we'll talk about that in the future. Okay, here's another one, fumonisins, and that's found in corn, milk, and breakfast cereals. They're finding that this mold is associated with esophageal cancer. I thought that was interesting. Esophageal cancer that like comes on suddenly and then people just die. It's important to get mold tested. I think everybody should just test to see if they have these mold spores in their body, especially when you see the link to these and cancer. It's really frightening. It's often found in corn. So if you're eating a lot of corn in the diet, including breakfast cereals and cornmeal, you're exposing yourself to this particular mycotoxin. Descending order of highest to lowest. So highest is bran, then flour, then meal, grits, and flaking grits. This slide just demonstrates that and how vulnerable your brain is to mycotoxins. Just, you know, ochratoxin A, which we just talked about. Mycotoxins can cause encephalomalacia, which is affects white matter of the brain, occurs in carbon monoxide poisoning as well. It's seen in heart disease of pigs, and they have this other problem called leukoencephalomalacia, and that can cause ataxia, tremor, circling, and depressed consciousness. So, and these are in animals. So, and it's usually caused by ingesting moldy corn. So here's the thing. If they're eating moldy corn and then we're eating the food that is eating the moldy corn, what do you think is happening? Yes, those mycotoxins are getting passed to us. And here's what some of the symptoms that mycotoxins have on cows. Okay. Intestinal, fertility, milk issues. I had milk issues. I wonder if that was related to mold, because I've been a carrier of Candida for a long time, and I had milk issues. I also got mastitis. Interesting. Let's see. Feed intake, impaired ability to regulate their temperature, convulsions. I mean, these are animals that are being affected by this. Why wouldn't they affect us? Here's some other symptoms. Okay, so I just kind of put this here for you to just kind of review. Difficulty regulating body temperature, increased urinary frequency, right? Tingling, mood swings, abdominal, tearing of the eyes, joint pain. So here's are the common ones that are tested in your urine. So combination of tests that includes your organic acids and mycotoxin have a really shed a bright light on a wide range of neuropsychiatric diseases. That includes autism, fibromyalgia, Parkinson's, and Alzheimer's. Most common is Aspergillus is associated, especially with Parkinson's. And that can be, can show up on your organic acid test. But also I would pair a mycotoxin test with it if you're doing it for the first time. Here's the Biotoxin Pathway that was created by Dr. Shoemaker. Notice sleep disturbances, GI issues, chronic pain, prolonged illness, changes in cortisol, hormones, and nerve cell impairments as some of the symptoms. Here's a snapshot of the mycotoxin by Great Plains. Aspergillus, aflatoxin, these are the most common. Gliotoxin. Okay, so what do? Remove yourself from the moldy environment. I can't stress that enough. Very, very, very important. You will not get better if you don't do that. You can detox, but you really got to remove yourself if you want to heal. Then you can do some binders and detoxification supports. These are some of the binders. Choleostyramine is a prescription. You can do bentonite clay, activate charcoal, chlorella, infrared sauna, NAC and glutathione, phospholipids, antifungal drugs, oral or IV glutathione for detoxification. Let's see what else. Probiotics, zeolite, which is one on top of my interest level. I'm actually going to do a little case study of my own. I'm waiting to run the organic acid test on myself, and I want to do the little detox vials. They're out of stock right now. Once they come back in stock, I'm going to order them, and I'm going to do a little zeolite test. And the preferred drug for Aspergillus is this right here, itraconazole. I don't know how to say that. Not my scope of practice. If you need to look into that more, you would want to speak to a mold literate doctor, MD. Okay, these are some natural treatments for MCAS, mast cells. So ascorbic acid, which is vitamin C, I don't recommend that in high doses. Quercetin, omegas, B6, B12, glutathione, curcumin from turmeric, P5P, which is B6, diamine oxidase if you have issue with histamine intolerance from food, resveratrol, methylfolate if you're dealing with low folate status, lactobacillus rhamnosus, bifidobacteria. There's just so many things you can try. Exercise is really important. I can't stress that enough. It causes the chemicals actually released from your sweat. And we're finding out that more chemicals are released from your sweat than they are from your gut, from your sweat. So I'm always surprised when I find out people with IC don't work out. And I understand that's because your bladder hurts and you probably have body aches and pains, but you really got to get away to sweat. Maybe whether that's working out or it's going into doing a sauna, but you really need to sweat. Saunas can induce sweating. You can also do whole body massages as well after. Make sure you wipe your sweat off because it can get reabsorbed back into the body. Then there's also, nutrient support, glutathione support, and drinking water. I like zeolite. It's on my target of things to look into. So if you notice, it can help get rid of aflatoxin, and so does charcoal from the gut. Zeolite does it inside the cell, and charcoal can remove it from the gut, and so can clay. So this is more of a cellular detox. And the rest of those are gut detoxes. I've never tried diatomaceous earth before. I got to research that a little bit more. Glucomannan is really good too. Also, if you think you have mold in your home, you should probably get an ERMI analysis done. Have somebody come in and do some samples in your home, and you can find out what your ERMI score is. Just keep in mind that it's not always the most accurate thing, but if your ERMI score comes out really high, I mean, there's something going on in your house. So, but don't always rely that even if it comes out negative or on the lower. What basically I'm saying is, even if it's in this range, like the yellow or the orange, I still think that that's significant. Okay, so unless you're in the negative, if any of these show up positive, you might be more sensitive to it. All right, here's another slide that demonstrates how gut health is really important for mental health. So there's a clear association with the gut-brain axis. Okay, we talk about that in the course. It's something I talk about often as well. I have other presentations on it, but this is just real quick. You should also consider running an HTMA test to understand where your minerals are standing, especially mercury. Mercury is also seen with mold and also with Candida because they can bind to the oxalates and are less likely to disassociate from the oxalates, if that makes sense. So you're less likely to be able to get rid of the oxalates in your tissue if you have a mercury problem. Because my mercury levels are through the roof, or were, because of my 6 amalgams I used to have in my teeth. And I've taken them out, so I'm still in the process of trying to get rid of them. I am going to do a mercury detox as well after I do my zeolite test. This slide is good. You can see the role fungus and Candida have. Okay, so once again, there's your protein, there's your hydroxyproline, Candida. produce this enzyme. By the way, this enzyme can actually break down hyaluronase in your anywhere in your body, and I believe in your tissue, in your bladder too. So Candida can actually break down your bladder tissue, I believe, because it can break down hyaluronic acid, which because of it has impairs activates hyaluronase, which breaks down hyaluronic acid. So I didn't include that on this slide, but that's another thing to keep in mind what Candida can do. But this has this collagenase, which can break down collagen into oxalate, which can go all the way down this pathway and become oxalate. And you got, again, I already went over this. So vulvodynia is important too. It's a syndrome of unexplained vulvar pain, and usually is acute. In most cases, it could be a chronic problem. And it's described as burning or stinging or feeling of rawness and irritation. Some of you really complain about this a lot, and I know I've had it before too. And here's some of the symptoms. It can also cause eye pain, pain on urination. So these are all related to oxalates, just so you know. Oxalates are 100%. Even the Vulvar Pain Foundation has made this association. So if you don't believe it, go look it up yourself. Google it. There is an association with vulvodynia and oxalates 100%. Just run an organic acid test. You'll know for sure. Citrate is why it helps. If you have Candida in the gut and you produce oxalates, you're consuming a high oxalate food. Calcium can bind to the oxalates, typo here, and citrate can help engage a transporting mechanism that causes oxalate to pump into the lumen of the gut, and the calcium expresses it as it gets out. Now, here's the thing. If you have a lot of a lot of mercury though, the bond between oxalate and mercury is really, really strong. So you might not be able to disassociate it as well in the presence of mercury. So that's why you have to do Mercury Detox too. Reduce mercury in your body. This biome is another high dose probiotic that they say is also great at degrading oxalates. But if you have SIBO or pandas, don't take this. Why? If pandas, the strep here is going to promote the symptoms of pandas. And if you have SIBO, these are going to promote your SIBO symptoms. So take care of the SIBO first, which is small intestinal bacterial overgrowth. Take care of that first before you try this. I used to not be able to handle probiotics, but I can now because I got rid of my SIBO. Okay, vitamin B6 is important as well. That's involved in oxalate metabolism. B6 is often low on the organic acid test, and every single person with IC I notice is B6 deficient. I need to spend a little bit more time on the connection with B6, but I know that it is a cofactor in serotonin production, and for some reason, it can increase bladder spasms. Now, I don't understand all that too much right now. I will look more into it, but that's just what I found. So I would say if you're going to try it, you want to dose it really, really slowly, and maybe even just do a little bit on your tongue at a time and just microdose it up so you don't deal with that, because you don't want to associate B6 with bladder spasms, because if you make that association, then you're not going to want to do it. So I would say start really, really low dose, but you do want to take the P5P form and also the pyridoxal form as well. So the two different forms of B6, you want to take both of those. Make sure you consume half of your body weight in liquid. It's so important for removing the oxalates out of your body as well, to flush it out. It makes, if your urine is concentrated, then you're going to have more concentrated oxalates, and that's going to cause more pain. And that's why you may notice that when you're dehydrated, you have more pain. If you know, some people think it's because the urine is more acidic, but I believe it's because the urine is more concentrated, has more oxalates per, think about it, right? If you dilute it with water, you're going to have less oxalates per ounce of urine. But if it's concentrated, you're going to have more oxalates. If you're going to decide to go on a low oxalate diet, it's recommended that you go really slowly. I talk about this in my modules, so make sure you follow the recommendations as outlined. Please do not try to drop your oxalates all at once like I did, because you'll end up in the emergency room and you'll end up having dumping, and that can cause your urethra to get blocked, which happened to me. Okay, I had a blocked urethra. I had urinary retention as a result of dropping my oxalates too quickly. Don't make that mistake, okay? Intervention strategies include, if you have Clostridia, get rid of that first. Lower your oxalates, treat your Candida, support your mitochondria, support your glutathione, and go ahead and run the GPL tox and glyphosate test just to see how toxic we are, because we may have to spend a little bit more time on detoxification. And of course, the mycotox profile is important too. And that's the end of that. Thanks for hanging by. I know this was long, but it was really important. Oh, I also want to mention you can also do Epsom salt baths too, 4 times a week. 2 cups of Epsom salt in bath water. Okay, that's another thing that can help with this whole process, especially with pain. All right, well, thanks for hanging by. I'm Dr. Mandy, and I'm glad that you are able to stick through this and understand the connection that all these things have to your symptoms, and hopefully we can work together to continue to improve your health. Thank you.